pack of cigarettes per day, that is very significant, and this can lead to cancers.
Sir, what is squamous cell carcinoma? How is it related to tobacco?
This squamous cell carcinoma is basically the type of cancer which comes in the squamous cells. These squamous cells are lines the entire mucosa of the entire aerodigestive tracts, starting from the lips to the lungs. Okay, so any cell which is exposed to these carcinogens can undergo mutations. There are several mutations at different levels of the cell growth. So each mutation can cause some changes in the cells, and finally this can lead to the cancer. So this cancer causing through this in this squamous cells is called as squamous cell carcinoma.
What are the signs and symptoms of these kind of cancers, sir?
Usually, initially these patients who have been before that, I would like to discuss something called as field cancerization. Field cancerization is something that whenever this tobacco comes in contact with a certain area of certain mucosa of the oral cavity, these cells undergo some changes. This entire region is susceptible to develop cancer. This is called as field cancerization. So whenever this means initially these patients who has symptoms, they present with a red patch or a white patch, and eventually this becomes an ulcer which goes deeper and deeper, or they may present with some small nodes in the neck, and these ulcers may infiltrate bone and then they cause pain and all. That's it.
So how does smoking affect larynx? No, and before that I wanted to ask about the management for this same thing.
Okay, so it depends upon the stage of the cancer, stage of the oral cancer. So this is basically divided into two major categories, either the early stage cancers or the advanced stage cancers. Stage 1 and stage 2 come under early stage cancers, and stage 3 and stage 4 comes under the advanced stage cancers. So for early stage cancer, what we prefer is a single modality treatment, that is either a surgery or a radiation, that's it. So chemo is usually not advised in oral cancers until and unless there are some advanced features. So for oral cavity cancers, the best treatment modality is surgery. For early cancers, only surgery is enough. For advanced cancers, we usually operate, we prefer them to operate, followed by we prefer them to give radiation, and chemo only if there are certain features like extracapsular spread or positive margins in the pathology report. Otherwise, we usually don't give chemo in normal settings.
Sir, how does smoking affect the larynx, the voice box?
As I already mentioned, the smoke comes in contact with the voice box. So this irritates the voice box, and this mucosa become cancerous and then causes cancer.
So we have few questions from the audience. First one is, it's been 3 years I'm smoking cigarettes. How can I stop smoking?
Okay. Any other?
And then we have, can quitting nicotine causes anxiety, and does nicotine increases depression?
Okay. So I will answer all this together. So basically my approach to this tobacco quitting is completely different. There are multiple ways, like using nicotine patches and using this e-cigarettes and all, but usually I don't prefer them. If you want to quit smoking or tobacco chewing, you should start the same day when you think about it. So means you need to avoid all those things which in favor of going for these habits, like if you want to go for a party, if you want to go for a pub and all, you should want to smoke, and try to avoid those friends. I know it's very easy to say and difficult to practice, but this works. If you stop it from the day one you think about it, this is gonna work. So but there are some side effects of stopping immediately, like if you stop it immediately you might have some anxiety and all, you might go into some depression. For this, what you can do is you can meet a psychologist, or you can go to the rehab centers where they will train you how to overcome these issues. But this reducing the frequency of cigarettes and using this nicotine patches and all are not that, as per in my opinion, I don't prefer this kind of things.
So coming towards our last question, Doctor, please tell our audience about the facility provided at Apollo Hospital, Jubilee Hills, Hyderabad.
Okay, In Apollo Hyderabad, I think head and neck department operated more than 10,000 head and neck cancers, and it's been the oldest head and neck department in the city. It's been there from the past 20-30 years. We are experienced in dealing with all kinds of oral cancers with latest reconstruction facilities like free flaps. We do 3D reconstruction and also rehabilitate the entire jaw so that we give the patients good function, form and aesthetics. So we consider all the three into the picture and do our surgeries.
Dear viewers, we have come to the end of our session and hope we have covered all the aspects. If you still have more doubts, you can book appointment with Dr. Abhishek, Budharapu and clarify your doubts. Thank you, Doctor, for educating our audience in today's session. Thank you for joining us. Stay tuned for much more educative live sessions.
Thank
Namaste.
you. Thank you.